We started out as two organizations addressing different needs. In the 1970s, Zacchaeus Free Clinic was launched by a group of volunteer doctors who wished to serve the city's poorest residents. At the same time, Bread for the City was established next door to help feed and clothe the poor. Over the years, these organizations worked closely together, understanding the significant overlap between their two populations. Eventually, we merged under the Bread for the City name. From the senior struggling to stretch his Social Security income to the working parent trying to get by on a meager paycheck, as long as there's a need, Bread for the City will be there to help. Our purpose is to provide support and guidance to anyone who comes through our doors in need of a helping hand. Poverty is often punctuated through a series of crises. Because of this, Bread for the City offers multiple services: food, clothing, medical care, legal aid, social services, provided under one roof and in an atmosphere of dignity and respect. Our current goals include the expansion of our food program to serve even more, the addition of new medical services, such as behavioral health care, and to further empower our clients. To do this, we need your support. Because our donations and grants come from many sources, we're able to weather the natural ups and downs of the economy and provide continual access to our services. But we don't serve 31,000 low-income D.C. residents per year with money alone. Our partner organizations and considerable volunteer assistance also play a critical role. However, the key component to our success lies within Bread for the City's name in the community. People seek us out because we're an organization they know and trust in times of need. What makes Bread for the City most effective is our ability to offer comprehensive support services: food, clothing, medical care, legal, and social services, all under one roof. For example, we may learn that a client's hypertension risk is spiking due to the threat of eviction. We can manage the health concern, and our legal clinic, which is mere steps away, can also help mediate the eviction issue. Offering these services in-house, where the client can access them the same day, increases our ability to address the root of the client's concerns, rather than just the symptoms. We can easily assess how many people we serve, whether it's how many clients we feed, clothe, provide medical care, or offer legal advice. 93% of our clients feel that they are treated with respect, and 92% feel that they receive the education and support they need to succeed. And while we're proud of our numbers, our greatest measurement for success is a client who no longer needs our services. The biggest misconception that people have about Bread for the City is that we only serve food. Granted, we are DC's largest food pantry, feeding nearly 5,000 households every month. However, we also understand that hunger is just one of the many symptoms of poverty. That's why we've developed into a wraparound service agency, allowing people to get help in a number of different areas when they visit us. We do all of this to better serve the unmet needs of the city's poor. Bread for the City is a leader in the push for higher nutritional standards in organizations that feed the poor. Long gone are the boxes of mac and cheese and ramen noodles on our shelves. Now clients are greeted with lean meats, whole grains, and a lot of fresh produce. Another significant accomplishment is the expansion of our Northwest Center, which has not only given us sorely needed extra space, but also paved the way for innovative new projects and services. Because of our larger facility, we've been able to plant the city's largest rooftop vegetable garden, host exercise classes, provide acupuncture services, teach computer and health literacy, and host weekly housing application workshops. The largest challenge we face is providing services to a low-income population that's become marginalized as DC has become more gentrified. In the past decade, affordable housing in D.C. shrank by 50%, and the neighborhoods that are left to the poor often lack basic amenities such as access to fresh food and public transportation. We're currently exploring how to expand our Southeast Center. The needs of our Southeast community exceed our ability to operate in our current space. We intend to add job creation as a part of our expansion plans. So one possibility includes mixing retail space into our design, space that may potentially serve as a training ground for our pre-employment program applicants. We would love to open our food program to more than just the elderly, disabled, and families with children. By including single adults, we would likely increase the number of visits to our pantry by 8,000 people per year. That increase would come with a significant price tag as we ensure that we have enough food to meet those numbers and the infrastructure necessary to manage it.